Hello and welcome. So in my earlier videos of heart and pericardium, I just gave you a very short introduction about this pericardium and heart. Now, today I will talk about this in very details in special videos. So it is a protective layer presents inside the middle mediastinum. Basically, it protects the heart, and it is a cone-shaped fibrous sac-like layer. Now, as this pericardium covers the heart, so the exact location of the pericardium depends on the heart's location. Heart is present from the second costal cartilage to the sixth costal cartilage, little bit laterally from the central axis of the body, and posteriorly it is present in between the T5 to T8. I mean 5th thoracic vertebra to the 8th thoracic vertebra. Now this pericardium has two layers. First of all, outer fibrous and inner serous. Inner serous is also divided into two layers. One is parietal layer, visceral layer. Now, first of all, our outer fibrous layer. Attachments of this outer fibrous layer. First of all, superiorly. Superiorly, it is continues as a pretracheal layer of deep cervical fascia. Okay, I will talk about this cervical fascia later, not now. Also, it merges with the outer layer of the big vessels, mainly the ascending aorta, pulmonary trunks, and the base or the inferiorly it is attaches with the upper surface of the central tendon to the diaphragm. I mean the upper surface of the diaphragm. Okay. Now anteriorly it is attaches with the upper and lower sternopericardial ligaments. Now one point, the structures piercing this outer fibrous layer. First of all, you will find the superior inferior vena cava, ascending aorta, then right and left pulmonary arteries, and then you will find 4 pulmonary veins. Now our serous pericardium, as I said, it has parietal layer and visceral layer. Now among this parietal layer, it is just below to the outer fibrous layer. Okay, suppose these three layers. Okay, this is the outer fibrous layer, this is the serous parietal layer, and this is the serous visceral layer. Okay, now just look at this outer fibrous layer and serous parietal layer, both stays together. You will find no space in between these two layers. Okay, and you will find a little bit space in between this serous parietal layer and the serous visceral layer. Okay, you will find a little bit space. Now this space is known as actual or proper pericardial space, which contains almost little bit 300 ml of serous fluid. Okay, or you can say pericardial fluid, because it is in the pericardial space. Common sense. And as I said, the serous visceral layer, this layer just stays above the epicardium. What is epicardium? I told you in my earlier videos that heart has 3 layers: endocardium, myocardium, epicardium. Now the blood supply of the pericardium, same style, arterial supply, venous drainage. At this point you have to remember one point, that as I said, outer fibrous layer and the serous parietal layer both stays together. Okay, and the the serous visceral layer stays separate. Now outer fibrous layer and the serous parietal layer both are supplied by the branches coming from the internal thoracic artery and descending thoracic aorta, gone, and the serous visceral layer is supplied by the coronary arteries, done. Outer fibrous layer and the serous parietal layer, both layer is drained via azygous vein and internal thoracic vein, and visceral layer is drained via coronary sinus. That's it, very simple. The nerve supply, outer fibrous layer and the serous parietal layer both are supplied by the phrenic nerves, gone. Now the inner visceral layer, the serous visceral layer is supplied by the vagus nerve, and the sympathetic component is supplied by the coronary plexus. See you soon with my next video with new topics. Till then, bye.